Hello everyone and welcome again to the Doctor Show. This is Dr. Zahra Al-Jumaili here, and I'm here to help you to understand more about medicine, about healthcare, more about anything that you've been wondering about. So you can always find us on social media. Please ask any question you want on Facebook and Instagram, and you can check all our other episodes on our YouTube channel. So today we're talking about something that's actually not a disease, but how to prevent the disease, which is something quite important. It's actually one of the most important things ever to do. What is it? I'm going to talk about the common tests and common regular checkups that we need to do in order to prevent a lot of diseases. Having to do checkups once every few years, and most of the checkups now that we're going to talk about them, they're once in every few years. So it will not harm us to waste a couple of hours every few years just to prevent a disease from happening. So I always say, and you should know, this is very, very important, that the prevention is much, much, much better than treatment and the cure of a disease. Because if you prevent it from having it from the first place, you will not even have it, you will not even need to live it and need to have it. So what do we do and how to protect ourselves from diseases in the future? What to do? We need to have a lot of regular checkups. About what? Let's talk about them one checkup at a time and one test at a time, and what to do. And later on, we're going to talk about specific tests that men and women need to do. Test number one, it's for you to check your lipids and cholesterol in your body. Yes, this is very, very, very important, especially if you have a risk of having someone in your family have any problems with high cholesterol and high lipids. If you eat an unhealthy diet, which is honestly, in this era that we're living in, most of us eat unhealthy food and junk food and all of that. So after the age of 50 or 45, every few years we need to have a check about our cholesterol. The doctor will withdraw a simple blood sample, and in this blood sample he will see HDL, which is the good cholesterol in our body, LDL, which is the bad cholesterol in our body, and the triglyceride, which is another type of fats. All these lipids and all these fats, it's very, very, very important for us to know the levels of them in our body in order to prevent other diseases. What if I have a high blood fat and cholesterol levels? Of course, we always know that these high levels of blood and cholesterol, they cause heart problems, literally heart stroke and heart attack. All of these small lipids, they will make your blood vessel, the blood vessel, it's like a circular inside, they make it much narrower. And when you have a narrow blood vessel, you are more susceptible to have a heart attack. And how is it actually narrow? It's going to accumulate on the wall of your arteries and veins. So imagine how dangerous that is if you actually eat a lot of fatty food. And please, you need to make this regular checkup. It's not like once every year. No, it's once every couple of years. But you need to do it once every year, or even more than that if you already have a heart problem and if you already have a family history of something like that. Number two test is for you to check your blood sugar. High blood sugar causes a disease called diabetes mellitus, and I'm sure it's a very common disease that we know that a lot of people have diabetes, and we're going to talk about them later on in a whole episode about how the importance of understanding diabetes. But having a blood sugar, we have a lot of blood tests, which is the random blood sugar and the fasting blood sugar. It's a small prick on your hand to get a drop of blood in a machine called glucometer. It just with the second you put this drop of blood, you will know the exact level of your blood sugar. Also, there is a blood test called hemoglobin 1c that shows the blood sugar within the past few months to make sure your blood sugar is not high enough. If your blood sugar high and if you eat a lot of carbohydrate and a lot of sugary food, you need to be careful and make sure not to actually get the disease, the diabetes, because diabetes is a catastrophic disease that affects your whole organs and your whole body, and it's super easy to actually avoid. Diabetes type 2, it's actually a self-induced disease. It means if you eat healthy, you might never have it. So it's very easy to prevent. So make sure that to eat healthy and not to have a lot of sugary food and carbohydrates, they make you have diabetes eventually. And make sure to test your blood sugar every now and then, every few years, to make sure that you're doing fine. And even if you find it a little bit high, you can easily control it with diet. It doesn't mean that you necessarily have the disease unless you go to a doctor and you get diagnosed with high blood sugar. The number 3 test, which is your blood pressure. Having a high blood pressure is, having the disease high blood pressure is something called a silent killer. To this extent, it's actually very, very dangerous. Why is it a silent killer? Because without you feeling it, it might get you heart problems and brain problems, and literally might causes you to die out of nowhere. Out of literally nowhere. So it's very, very, very important to prevent and to diagnose yourself if you have high blood pressure. Every few years, you need to check yourself. So all of whatever tests I'm saying, all of that, you need to do them above age 45 to 50 to make sure you always have good blood pressure. The blood pressure, you know, the machine, the device that the doctors put and then actually hear it and pump the air. This device needs to be having the reading 120 over 80 millimeter mercury. That's the healthy blood pressure. If it's a little bit high, it does not mean you are diagnosed with high blood pressure. It means we need to regularly check much, much more times, like 3 or 4 times a day, and then on other regular times, the doctor will need for you to measure it much, much more in order to have an accurate diagnosis that you do have high blood pressure. If you do have high blood pressure, the doctor will describe you a few medications that you need to take them to the rest of your life. To the rest of your life. Imagine how dangerous it is to have high blood pressure. So it's easily you can avoid it by having regular checkups, and you can protect yourself and prevent it from happening in general. So please make sure to get your high blood pressure checked. The test number 4 is you having dental checkups. Yes, it's very important to check on our teeth. And the dental checkups, it needs to be from a young age. Twice a year, every 6 months, you need to go and get yourself checked to have a actual dental checkups to see if you have any abscesses, if you have any cavities, to make sure to have an x-ray on your teeth, because even if you brush your teeth twice a day, it's not enough. You need to have flossing. You need to make sure not to eat a lot of sweet foods. You need to make sure to keep your teeth hygiene always, always, always perfectly fine. So please make sure to go get your teeth checked twice every year. What else? There is something not very common that people know, which is a colorectal cancer. Colorectal cancer is one of the leading causes of death worldwide, and people don't talk about them enough. What does it mean? It means that you have a type of cancer in your large intestines and the large bowels. How do we know if we have it? If you've just celebrated your 50th birthday, well, it's time for you to check, to have a colonoscopy and check if you have any colorectal cancer, and you need to check it every few years to make sure you're fine. But you don't have to worry. The colonoscopy is just a small camera in a tube that that the doctor puts it to see your large intestine, and this camera actually sees, the good news is that the camera sees any few changes, any small changes in your large intestines, so we can prevent it from super early age of cancer. So even if you have it, even if you have a family history of colon cancer, you have to go get yourself checked. The colonoscopy only takes 15 to 20 minutes. It will not disrupt your day at all. It will not actually harm you in any way possible. It has no risk factors, no risks whatsoever. So it's just a small test that you need to do. Both male and female need to do it very regularly, because it's very, very, very important to prevent it. If you actually have a heart problem and high cholesterol and you're in a high risk and all of that, and you're above the age of 60, you need to always get yourself an ultrasound check, even males, yes, because there is something called an abdominal aortic aneurysm. What is that? So the aorta, it actually could cause a balloon in the aorta to be, there's a risk of it rupturing any moment, and the rupture of the aorta could actually make you die within a few seconds. 90% of people who have it usually don't even survive, and it's not even enough time for them to go to the hospital. So it's very, very, very important to get an ultrasound check, especially if you have any high blood pressure, and if you have cardiac diseases, and if you have high cholesterol levels. So make sure just to get yourself checked. And one of the most important things for you to check is your mental health. We always say the mental health is much more important than the physical health. Mental health is super important. Why? What's a good use of your whole body if you're mentally not okay, right? So it's actually very important to make sure you diagnose yourself, or you focus with yourself if you have a low mood, if you lose interest in life within more than a couple of weeks, if you lose interest in your daily activities, if you lose interest in anything you usually love. If you feel a low mood in general, you need to definitely immediately go to a therapist, because if you get diagnosed with depression, you need to go to therapy and have medications if you need to. It's very, very important. People don't talk about it, but 6 million people every single year, they get diagnosed with depression in the USA. So imagine how much a huge number of people get depression every day, and we don't even notice, and we don't even feel, and we think it could pass by. The depression could cause more dangerous things in the future. So please make sure to go and get your self-checked with a therapist and a psychologist to make sure you're very fine. There are a few tests that's only for men and only for women to go check once a while. The ones only for men, it's actually just one test, which is called a PSA, which is a prostate-specific antigen. It's actually a small test we do to make sure the prostate is actually very healthy. So the prostate is one of the most important things to check as an old man after the age of 50. Every few years, you need to check for your PSA, because it's an indication of you having a prostate cancer or not. So it's very important. Prostate cancer is as dangerous as breast cancer in females. So you need to get yourself checked and make sure to read the guideline very well, how to do the test, because sometimes a false positive test leads to a lot of unnecessary biopsies and unnecessary procedures. So make sure you ask your doctor before the test and after the test, what do you do specifically to do the test. What are the tests that we do in females? In females, actually, we all know that the most common cancer in females is the breast cancer. And in order to avoid that, in old age, actually, if the lady is young, she needs to do the test after 21 years, after turning 21, if she has history of breast cancer, if it's any of a close relative, her mom, her aunt, her grandma have it, she needs to go get herself checked. But usually we tell ladies after age of 45 to get something called the mammogram. What's a mammogram? It's basically pressing the breast against an X-ray machine that takes one image. It takes literally nothing. It takes no time. You can have it within 5 minutes, and to check if you have any abnormalities in your breast tissues. So it's very, very, very important, especially if you have genetic predisposition, especially if you have anyone in your family that has breast cancer or ovarian cancer, because both of them are related to each other. So please, 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 this is very important for you to do. Even if you don't do mammography, make sure to do a bimanual check. Every now and then you have to, when you're in the shower, when you're changing, you have to check your breast and to see if you feel any abnormal tissue that you've never felt before. And there's always a guideline and a manual how to do it and how to do the steps. You can search them online to make sure to get yourself checked. What else? We have the bone density test. We always need to do a test called the DEXA test, DEXA scan, which is just a test like a low-dose X-ray to check all your bones in your body, because the ladies in the old age, they're very susceptible to having a low-density bone, which is very dangerous, because in the future they might have a easy bone breakage in any fall they have or anything. They could even make them have bone aches. So make sure to have your bone density. So we need to have it every few years, and when you're very old, you need to have a human papillomavirus test as well, also STD check as well, to make sure you're perfectly fine. All these tests are very simple, they're not very expensive. You can get them for free at certain centers in your country, so make sure to research it. And some governments, they actually have it mandatory to do that, so hopefully we do as well at certain points. That's basically it for today. Please make sure to stay healthy, to get your regular checkups, because they're very, very important to prevent life-threatening disease. And diseases can cause a terrible lifestyle. So please stay healthy, eat healthy, and make sure to exercise. Thank you very much for watching, and I'll see you guys next Tuesday.